How to use pre-treatment photo documentation. Shave and clean the treated area before treatment. Apply 2 mm thickness of clear coupling gel evenly on the treatment area. Tap Register. Enter customer name and password. If you have already registered, enter your name directly and click Login. Select gender, treatment area and skin color according to customer's skin color. Click Cooling. Click Start. Operators wear eye protection. Put the treatment head vertically close to the skin. Press the switch on the handle with the index finger or step on the foot pedal with the foot. Slide the operation in the operation area at an even speed. Slide one line to overlap the next line by a half. Observe the skin while operating and ask whether there is a hot tingling sensation. No hot tingling sensation can be appropriately increased energy. If overheating, then reduce the energy. Observe the skin while operating, subject to the appearance of the clinical endpoint of the treatment. The treatment can be stopped by one of the following: slight redness and bulging of the hair follicle, slight curling of the hair, thermal distension of the hair follicle, reddening of the skin, and a persistent heat sensation under the skin. Tap Pause after operation and put the treatment handle back to the holder. Tap the upper right corner to save. If the patient has flushing, erythema or redness of the skin, you can use the handle operating head to ice the treatment area for 10–15 minutes. Scrape off the coupling agent gel. Dry the skin with room temperature water. You can apply some non-irritating moisturizer or aloe vera gel. Demonstration of nose hair manipulation.